we'll start off this lecture with a little bit of a question. Have any of you guys ever encountered a learner that you felt like was difficult before? Anybody? What kinds of learners have you guys encountered that are difficult? What specific type of learner is most frustrating to you?
The argumentative learner?
Good. We'll talk about the argumentative learner. Absolutely.
Someone who doesn't want to learn and thinks that they're right.
The uninterested learner. I like that. The stubborn learner. We'll talk a little bit about that. Anybody else? Nobody else deals with difficult learners? Yep, the arrogant learner. Excellent. Good. So we'll cover a little bit of that too. So one of the things that I think is most frustrating to deal with the difficult learner is that people don't have a framework for what to do about them. People interact with them in the setting and in the moment, and they move on because they don't really know how to think about the difficult learner, how to engage with the difficult learner in a way that's productive. So that's part of our goals of the session today. Is we want you to come out of this session with a sense of what to do, a strategic approach every time you encounter a difficult learner, because I think the techniques that we're going to talk about today are applicable to a wide variety of difficult learners, from the arrogant to the disengaged to pretty much whatever you encounter. So what we want to talk about today is the SOAP technique. And you may be familiar with this from the SOAP note or similar sorts of things. This is subjective, objective, assessment, and plan. And I think this is the first thing you should think about when you think about your difficult learner. So the subjective. Tell the learner how you're feeling about what they're doing. I was really frustrated when you were asleep in my lecture today. Tell them that you were upset by their behavior. Tell them what it was specifically, the objective that made you upset. When you were challenging me about every point that I was making during lecture, that was what I found particularly objectionable. Assessment. Talk about why it was happening. This is a conversation with your learner, because oftentimes this is not necessarily what you expect. The example would be, the disengaged learner. Maybe they're disengaged because they are really burned out. They have been working 6 night shifts in a row, and it's not that they don't like your lecture or don't like you or what you're saying. It's that they're too tired to engage in your lecture. So find out with them. Tell me a little bit more about why you think this happened today. And then come up with a plan. What should happen differently next time? And this is also a conversation with them. This should not be you telling them, I want you to be less disruptive during the next lecture that I give. It's when you encounter this situation again, tell me what you think we can agree on that would be different, that will be a good plan, a more productive plan for moving forward.
All right. And thinking about the SOAP stuff, I don't always tell them my subjective, because sometimes it's like, I want to wring your neck, right? And me saying that to them is not at all productive. So I may leave part of that out. But thinking about when you have that conversation with them afterwards. So we're going to talk about what you do in the moment, but then also what you do with that conversation afterwards. And when I start that conversation, I always talk about, or I always make it obvious that I have an educational alliance with them, right? I'm giving them this feedback because I want them to get better. I want them to learn. I want them to become that amazing emergency physician that I know they can be, because they'll be much more receptive to your feedback. Where's that clicker thing? They'll be much more receptive to your feedback if they know that you're doing it with good intentions to help them get better, as opposed to just, being mean, or however they might interpret it. I use a lot of advocacy inquiry in situations like this, and those of you in simulation probably recognize this as a debriefing technique. I use it in lots of other areas as well. So your advocacy inquiry is essentially stating something objective that you noticed, and then talking about what your thoughts are and asking for their input. So for example, for that learner who's just constantly talking, answering all the questions, asking all the questions, sharing their anecdotes, they just won't be quiet in your session, you may say something like, I noticed that you were really engaged in lecture today, which is awesome, and I really appreciate your feedback. However, it seemed like you were interrupting people to get your points across. I'm concerned that this may not really be interpreted positively by a number of other people, and I'm curious to hear your thoughts on that, so that you really can kind of get into why they're doing what they're doing. You're trying to discover their frame, right? The underlying way they're thinking about this thing that is driving the behavior that you're seeing. Because only once you get to that frame, you can change the frame, which will change the behavior. Telling them, stop interrupting my lecture, is not going to get you a different result the next time. And then, like Ben said, this assessment and plan can go anywhere, right? You're thinking about your SOAP before you have the conversation with them, and you're thinking, I bet this person is disengaged because they don't care, right? But once you start asking them questions, it can go anywhere. So you have to be okay with having this discussion go anywhere that you didn't expect, and then cooperating with them to develop a plan that works for both of you. And to get to that endpoint, you may need to ask multiple questions, right? You may be able to do one advocacy inquiry question, but you may have to do 2 and 3 and 4 and say, tell me a little bit more about that. Tell me more about that, to really get to what that thing is so that you can change it going forward. So we're going to have you guys do a small group activity now. And in the middle of your table, you have some papers that are turned over face down. So go ahead and flip those face down ones over and take a look at that. This is your case vignette of a difficult learner that you had in your session. Now, in your groups, we're going to, so let's split you guys up maybe kind of 3 and 2 here. So you have slips for them. You guys.
We need one learner and one educator at each table, and we've got an extra slip of paper once you guys have read that for the learner.
Yep. So we can split 2 and 2 here, and then these guys can be one group of 2.
All right. So when you've identified your pairs and when you've identified who your learners are going to be, learners, put your hands up.
So one out of each of the two pairs is going to be the learner.
Okay.
Whoever that is, raise your hand. You get a secret slip.
Keep your piece of paper secret.
Okay.
Learner. Learner. Learner.
All right.
All right.
Sally
Keep your
is
piece
going
of
to be
paper
a
secret,
learner.
but you can read
Here's
it.
your secret slip, and you'll be a learner. There's your secret
What's that?
slip.
Sure, you can read the paper.
Yeah, the facilitators can read the papers to help the teacher.
Yep.
But the teacher can't read the little paper.
So once you're done reading, and you guys have a pretty good sense of what your roles are, as the educator, go through that SOAP exercise and work through your discussion with the learner of why you had the difficult interaction today, and see if you can move your way through the SOAP. Practice moving your way through the SOAP mnemonic.